Dear colleagues, let's browse the dental literature for you. Anxiety is a mental state marked by excessive and irrational worry or fear in response to specific environmental triggers, as defined by the Diagnostic and Statistical Manual of Mental Disorders, DSM 2013. Dental anxiety, DA, is a common type of anxiety that affects individuals across all age groups. Studies show that DA prevalence in children and adolescents ranges from 20.4% to 27.3% globally, while in adults it varies between 7.4% and 21.4%. Notably, Asia exhibits the highest rates of DA, with recent research indicating that up to 35.39% of Chinese adults may experience DA. Let's find out more in our podcast on this topic.
All right, so today we're diving into something kind of different.
Oh,
Yeah, it's something that just might change how you think about going to the dentist.
okay. I'm intrigued.
Yeah, so we're talking extended reality,
Oh,
XR for short,
okay.
and how it could be the key to conquering those dental jitters. You know that feeling, right?
Oh, yeah.
The one where your heart starts racing just thinking about the dentist's chair.
Oh, absolutely. You're definitely not alone.
Yeah.
I mean, it's estimated that over 20% of people globally experience some level of dental anxiety.
Wow. Okay, so it's more common than I thought, but serious consequences.
Ah.
How so? Is it really more than just feeling a bit nervous?
Yeah, well, think about it. If people are avoiding the dentist because of fear that can lead to a whole cascade of problems, they might miss routine checkups,
Right.
which means small issues turn into big ones.
Oh, yeah.
And that usually means more complex and expensive treatment down the road.
Makes sense.
Not to mention the impact on overall health and well-being that can stem from neglecting your oral health.
Wow, I hadn't really thought about it like that. I guess I always assumed dental anxiety was just a minor inconvenience, not something that could have such a ripple effect.
Exactly. That's why this research paper published just a few days ago in the Journal of Dentistry caught my eye.
Oh, wow.
It's a deep dive into how XR could be a game changer for managing dental anxiety.
Okay, now you've got my attention. So remind me, what exactly is XR? I know it has something to do with VR, but it's all a bit blurry to me.
Right, so XR is basically an umbrella term that covers both virtual reality and augmented reality with VR.
Okay.
Think full immersion. You put on a headset and are transported to a completely different environment. It could be a peaceful beach, a lush forest, or even a fantastical world. AR, on the other hand, blends virtual elements with your real surroundings.
Ah, so like those filters people use on social media.
Yeah.
But probably a lot more sophisticated.
Exactly. And the idea is that these immersive experiences can be incredibly powerful for managing anxiety. So instead of staring at the ceiling in the waiting room, feeling your heart pound, you could be swimming with dolphins or exploring a virtual museum, all while waiting for your appointment.
That definitely sounds more appealing than the usual pre-dentist routine.
Yeah.
But how exactly does this help with anxiety? Is it just about distraction?
Distraction is definitely a part of it, but there's more going on.
Okay.
XR seems to work on a few different levels. For one, it can help regulate your heart rate and breathing by activating specific nerves.
Interesting.
And then there's the fascinating gating theory of pain.
Gating theory. Sounds intriguing, but I'm totally lost. Break it down for me.
Okay, so it's the idea that focusing on a pleasurable VR experience can actually block or reduce the transmission of pain signals to the brain. Imagine you're immersed in a beautiful, calming virtual environment. Your brain is so busy processing this enjoyable sensory input that the pain signals get gated or blocked, making the experience less intense.
So it's like our brains can only focus on so much at once, and the VR experience is basically hogging all the bandwidth.
That's a great way to put it. And a key player in all of this seems to be the anterior cingulate cortex, or ACC, a part of the brain involved in attention and emotional regulation.
Now that you mention it, I vaguely remember reading something about the ACC in a psychology class years ago. But how does it tie into XR and anxiety?
Well, the ACC plays a role in how we perceive and respond to threats. XR seems to modulate activity in this region, helping to reduce the perception of threat and promote a sense of calm. Like XR is giving our brains a little vacation from anxiety.
I am definitely ready for that vacation. So tell me more about this research. Did they actually prove that XR helps with dental anxiety?
So this particular paper was a meta-analysis, which means they combined data from 10 different studies with a total of 950 participants. That's a pretty robust sample size. And the results were pretty impressive. They found that XR significantly reduced anxiety scores compared to control groups. Not only that, but it also lowered pain scores and even blood pressure during dental procedures.
Wait, it reduced actual pain, too. That's incredible. I have to ask, what kind of VR experiences were people having in these studies? Were they all just staring at calming scenery?
There is a variety of XR experiences used. Some involved peaceful imagery, like ocean floors or botanical gardens, while others offered interactive activities like virtual flights or games. It seems like having a choice and finding something personally engaging is important.
So it's not just about creating a generic, relaxing experience. It has to be something that resonates with the individual.
Precisely. We're all wired a bit differently, and what one person finds calming might not work for another.
That makes sense. It's like finding the right meditation app
Right.
or relaxation technique.
Yeah.
It's not one size fits all, but I am curious, were there any specific apps or programs that stood out in the research?
One that caught my eye was a program that uses biofeedback integration.
Okay.
It's pretty cutting edge. It actually tracks the patient's physiological responses,
Oh, wow.
like heart rate and skin conductance, and adjusts the VR experience in real time to promote relaxation.
Whoa, so it's like the VR is learning and adapting to the individual's anxiety level. That's next level. But let's shift gears for a minute. We've talked a lot about the upsides, but what about the downsides?
Yeah.
Are there any risks or challenges associated with using XR in dentistry?
Yeah, that's a great question, and it's important to acknowledge that XR isn't a perfect solution for everyone.
Right.
One potential issue is something called virtual environment sickness, which is kind of like motion sickness.
Okay.
Some people experience nausea, dizziness, or headaches when using VR headsets.
Okay. That doesn't sound fun at all.
Yeah.
How common is this virtual environment sickness? Is it something that most people experience or just a small percentage?
It varies quite a bit depending on the individual and the specific VR experience.
Yeah.
Studies suggest that anywhere from 10% to 40% of people might experience some degree of virtual environment sickness, especially with more immersive VR setups.
That's a pretty wide range.
Yeah.
So how do you know if you're someone who's prone to this? Are there any red flags or warning signs?
Well, that's where careful screening comes in.
Yeah.
Before using XR in a dental setting, it's crucial to ask patients about any history of motion sickness or similar issues.
Okay.
There are also questionnaires and assessments that can help identify individuals who might be more susceptible. And of course, starting with shorter VR sessions and gradually increasing the duration can help minimize discomfort.
Makes sense. It's all about starting slow and seeing how your body reacts. And what about the cost of all this? VR equipment isn't exactly cheap. Is this something that most dental practices could realistically afford?
That's a valid concern. The initial investment in XR technology can be significant, and that's definitely a barrier for some practices. But it's important to look at the potential long-term cost savings.
Okay.
If XR can help patients manage anxiety and avoid more complex treatments down the road, it could actually save money in the long run.
So it's like an investment in preventive care, spending a bit more upfront to potentially avoid bigger expenses later on.
Exactly. Plus, as technology advances, the cost of XR equipment is likely to come down, making it more accessible to a wider range of practices.
That makes sense. Okay, so let's say XR does become more widely adopted in dentistry. Do we have any evidence that it actually provides lasting relief from dental anxiety? Or is it just a temporary distraction? I mean, once you take the headset off, are you back to square one?
That's a really important question, and it's something that researchers are still exploring. Some studies suggest that repeated exposure to XR therapy, particularly when combined with other cognitive behavioral techniques, can lead to longer-term reductions in anxiety.
So it's not just about masking the anxiety in the moment. It's about actually rewiring the brain's response to dental situations.
That's the hope. Think of it like exposure therapy. By gradually exposing yourself to the feared situation in a safe and controlled virtual environment, you can start to desensitize yourself to those triggers and develop healthier coping mechanisms.
Fascinating. Seems like XR could be a powerful tool for helping people overcome all sorts of anxieties and phobias, not just dental ones.
Absolutely. It's already being explored for things like fear of flying public speaking and even post-traumatic stress disorder. The possibilities are really quite vast.
It makes you wonder what other areas of healthcare could benefit from XR technology. I mean, if it can help with something as common as dental anxiety, imagine the potential impact it could have on other conditions.
That's a question worth pondering. But before we go too far down that road, I do want to touch on one more important aspect of XR in healthcare, the issue of accessibility and equity.
That's a crucial point. We've talked about the cost barrier for dental practices, but what about for patients? Not everyone can afford a fancy VR headset. How do we ensure that this technology doesn't just benefit those who can afford it?
That's a key ethical consideration. One approach could be to advocate for insurance coverage or subsidies to make XR therapy more affordable. Another is to explore ways to make the technology itself more accessible. For example, developing XR programs that can be used with smartphones or less expensive devices.
It's like we need to make sure this tech doesn't, create a digital divide in healthcare.
Yeah.
Everyone should have the opportunity to benefit from these advancements.
Yeah, absolutely. It's about ensuring equitable access and making sure that XR isn't just a luxury for the privileged few. But, beyond the practical considerations,
Yeah.
there's also a deeper question about how we integrate this technology into our lives in a thoughtful and responsible way.
What do you mean by that?
Well, it's easy to get caught up in the excitement of new technology and its potential benefits, but we also need to be mindful of the potential downsides. For example, some people worry that excessive reliance on VR could lead to social isolation or a disconnect from the real world.
Yeah, it's a valid concern. It's like anything else, moderation is key.
Right.
We need to find a balance between embracing the benefits of XR while also maintaining healthy boundaries and real-world connections.
Precisely. It's about using technology to enhance our lives, not replace them. And I think that's a good note to end on.
It is. So for our listeners out there who might be dealing with dental anxiety or just curious about XR, what's one key takeaway you'd like them to remember from our deep dive today?
I think the most important message is that there's hope. Dental anxiety is a very real and very common problem, but there are also increasingly effective ways to manage it. XR is showing incredible promise as a tool for reducing anxiety and pain, and as the technology continues to evolve, we can expect even more innovative applications in the future.
It's like we're on the cusp of a whole new era in healthcare, where technology is being used to address not just physical ailments, but also mental and emotional well-being.
Exactly. It's an exciting time to be alive, and I can't wait to see what the future holds.
Well said. And on that note, dear deep divers, we've reached the end of another fascinating exploration. We hope this deep dive has sparked your curiosity and given you some new insights to chew on.
If you're one of the many people who dread going to the dentist, don't despair. There are solutions out there, and XR might just be the game changer you've been waiting for.
And hey, if you're feeling adventurous, why not try out a VR relaxation app and see for yourself what all the buzz is about? You might just find yourself looking forward to your next dental appointment. Who knows?
Until next time, keep exploring, keep questioning, and keep diving deep into the world of knowledge.